Theory and Practice of Counseling and Psychotherapy, 10th edition. Chapter 5, Adlerian Therapy. Introduction. Adler founded the Society for Individual Psychology in 1912. Freudian revisionists agreed that relational, social, and cultural factors were of great significance in shaping personality. Adlerian psychology principles applied to education, parenting, individual and group therapy, and group counseling. View of human nature focused on the person's past as perceived in the present and how an individual's interpretation of early events. Inferiority feelings are normal and a source of all human striving, are the wellspring of creativity, develop when we are young, characterized by early feelings of hopelessness. Superiority feelings promote mastery and enable us to overcome obstacles. Subjective perception of reality. The world is seen from the client's subjective frame of reference described as phenomenological. Subjective reality, paying attention to the individual, the way in which people perceive their world. Strive to understand the world from the client's vantage point. Unity and pattern of human personality. For Adler, individual psychology meant indivisible psychology. Takes a holistic approach in that we must understand ourselves in socially embedded contexts rather than in parts. Assumes that all human behavior has a purpose in relation to achieving our goals. The guiding self-ideal. A life movement that organizes our reality, giving meaning to life. Fictional finalism or guiding self-ideal. Striving for perfection implies striving for greater competence for the common good of others. Lifestyle described as our perceptions regarding self, others, and the world. Social interest and community feeling. Adler's most significant and distinctive concept. Social interest, bonding people feel for each other. Mental health is measured by the degree to which we share with others and are concerned with their welfare. People express social interest through shared activity, cooperation, participation in the common good, and mutual respect. Embodies a community feeling and the capacity to cooperate and contribute to something bigger than oneself. The life tasks. We must successfully master 3 universal life tasks. Building friendships, which is a social task. Establishing intimacy, which is a love-marriage task. Contributing to society, which is an occupational task. Each of these tasks requires the development of psychological capacities for friendship and belonging, for contribution and self-worth, and for cooperation. Birth order and sibling relationships. 5 psychological positions. Oldest child receives more attention, spoiled, center of attention. Second child of only 2 behaves as if in a race, often opposite to the firstborn. Middle child often feels squeezed out. Youngest child, the baby of the family. Only child does not learn to share or cooperate with other children, learns to deal with adults. Therapeutic goals. Collaborative arrangement between the client and the counselor. General psychological investigation or lifestyle assessment, disclosing mistaken goals and faulty assumptions. Emphasis on health, well-being, and prevention of problems. Therapist's function and role. Client becomes discouraged because of mistaken beliefs, faulty values, and useless goals. Family constellation includes parents, siblings, and others in the home, life tasks, and early recollections. Early recollections are stories of events that a person says occurred before 10 years of age. Life assessment. learning to understand the goals and motivations of the client. Application, therapeutic techniques and procedures. Phase 1, establishing the relationship. Supportive, collaborative, educational, encouraging process. Person-to-person contact with the client precedes identification of the problem. Help client build awareness of his or her strengths. Phase 2, assessing the individual's psychological dynamics. Lifestyle assessment. Subjective interview, objective interview, family constellation, early recollections, basic mistakes. Phase 3, encouraging self-understanding and insight. Interpret the findings of the assessment. Hidden goals and purposes of behavior are made conscious. Therapist offers interpretations to help clients gain insight into their private logic and lifestyle. Phase 4, reorientation and re-education. Action-oriented phase. Emphasis is on putting insights into practice. Clients are reoriented toward the useful side of life. Clients are encouraged to act as if they were the people they want to be. Encouragement. Encouragement is the most distinctive intervention and is central to all phases of Adlerian therapy. It is a fundamental attitude more than a technique. Expecting clients to assume responsibility for their lives builds their self-confidence and courage. Discouragement is the basic condition that prevents people from functioning. Adlerian techniques: immediacy, advice, humor, silence, paradoxical intention, acting as if, catching oneself, push-button technique, externalization, reauthoring, avoiding the traps, confrontation, use of stories and fables, early recollection analysis, lifestyle assessment, encouraging, meditation, task setting and commitment, giving homework, terminating, and summarizing. Other areas of application: child guidance, parent-child counseling, couples counseling, family counseling and therapy, group counseling and therapy, individual counseling with children, adolescents, and adults, cultural conflicts, correctional and rehabilitation counseling, and mental health institutions. Application to family counseling. Focus on the family atmosphere, the family constellation, and the interactive goals of each member. Family atmosphere is the climate characterizing the relationship between the parents and their attitudes towards life, gender roles, and decision-making. Increase awareness of the interaction of the individuals within the family system. Application to group counseling. Group provides a social context in which members can develop a sense of belonging, community, and social relatedness. Sharing of early recollections increases group cohesiveness. Action-oriented strategies for behavior change are implemented to help group members work together to challenge erroneous beliefs about self, life, and others. Employs a time-limited framework. Strengths from a diversity perspective. Adlerian therapy focuses on multicultural and social justice issues and addresses the concerns of a contemporary global society. Concepts of age, ethnicity, lifestyle, sexual, affectional orientations, and gender differences emerge in therapy. Adlerians focus on cooperation and socially oriented values. Adlerians investigate culture in much the same way that they approach birth order and family atmosphere. The approach offers flexibility in applying cognitive and action-oriented techniques to help clients explore their problems in a cultural context. Adler was one of the first psychologists at the turn of the century to advocate equality for women. Shortcomings from a diversity perspective. The approach focuses on the self as the locus of change and responsibility, which may be problematic for some clients. Exploring past childhood experiences, early memories, family experiences, and dreams may not appeal to all. If clients expect the therapist to be the expert, they may be dissatisfied with Adlerian's collaborative stance. Contributions of Adlerian therapy. This approach is flexible and integrative. It allows for the use of relational, cognitive, behavioral, emotive, and experiential techniques. It is suited to brief, time-limited therapy. Many of Adler's ideas were revolutionary and far ahead of his time. Many of his ideas have found their way into most of the other therapeutic approaches. Limitations and criticisms of the Adlerian approach. Adler spent most of his time teaching his theory as opposed to systematically documenting it. Many of Adler's ideas are vague and general, which makes it difficult to conduct research on some concepts. Although brilliant in many ways, Adler was not scholarly.